Right, let's go. I want to further reveal the coronavirus folly which has overwhelmed the nation. It was King Lear in Shakespeare's play of the same name who argued, and I quote, "'Tis the time's plague when mad men lead the blind." How appropriate is that to where we are today? Those bellowing directives to us, blind to reality. The public are distressed. Wrote one of my listeners of his great uncle, quote, "He died in France from a German sniper's bullet at the age of 28. He was awarded the Military Cross at Buckingham Palace. What did he and thousands of other Australians die for, Alan?" Another says, "It's my assumption that 331 deaths at an average age of over 80 in a population of 25 million would not justify shutting down the economy and imposing martial law on the state of Victoria. Has the government lost the plot?" He says currently Australia is the only country in the world that will not let its citizens cross its borders. Another from New Zealand says to me, "It seems everybody who dies, even if they get hit by a bus, is a COVID death." And the Prime Minister is now telling us these restrictions are, quote, "likely to remain in place until the end of the year." And don't dare ask a question. Rachel Baxendale from the Australian newspaper asked last week what should have been asked long ago. Could Daniel Andrews explain the quarantine fiasco she's been pilloried on social media? Yet on the opening day of the inquiry into the hotel quarantine farce, which now in another dictatorial stance has been adjourned, senior counsel assisting the inquiry said, and I quote, "It might even be that every case of COVID-19 in Victoria in recent weeks could be sourced to the hotel quarantine program." Then we get the Aged Care Royal Commission yesterday. Remember, from the outset, we knew, as Andrew just said, the elderly were at greatest risk, and as a nation, we must accept the responsibility to look after them, protect the vulnerable. But the Aged Care Royal Commission yesterday revealed there was no national coordinated plan to help the aged care sector with the coronavirus, despite the elevated risk it obviously posed to the elderly. Counsel assisting the Aged Care Royal Commission argued, and I quote, "The evidence will reveal that neither the Commonwealth Department of Health nor the Aged Care Regulator developed a COVID-19 plan specifically for the aged care sector," unquote. The Commonwealth Department of Health. What must families who've lost loved ones be thinking? The much maligned Tony Abbott covered all of this territory in a brilliant speech as Health Minister in May 2005 to a World Conference on Infectious Diseases. He argued then that in the wake of a likely pandemic, and I quote, "Australia should commence border security measures beforehand." We did not. We kept importing the virus. In 2005, he said, every incoming passenger would be required to make a health declaration. Thermal scanners would operate at international airports to detect possible flu cases on entry, and quarantine isolation areas would be established. None of that happened. Indeed, as Health Minister, he released in 2005 a pandemic influenza awareness kit to every GP. In other words, the federal government and the nation were told this by Abbott in 2005. What we've witnessed is wanton betrayal, especially of the elderly. Today we're told that we should feel the force of a bright light, that the new cases in Victoria totaled 322 yesterday, the lowest increase in weeks. Poor compensation. As Alana wrote last week, quote, "We didn't flee a dictatorial regime in Europe to be forced to live under another one, and in Australia of all places." Remember this, when people are forced into isolation in their private homes and made fearful of some great disaster, which it's not, what happens? The state becomes powerful. The individual becomes weaker. We're mugs if we cop this stuff. As The Spectator magazine argues this week, and I quote, "Curfews are tools of political repression, of martial law, of military occupation. They are not part of living in a thriving parliamentary democracy." Which brings me to an outstanding piece of scholarship by Emeritus Professor Ramesh Thakur from the Crawford School of Public Policy at ANU. He refers to the World Health Organization's guidelines on non-pharmaceutical interventions, published last October and based on, quote, "the latest scientific literature." In a study of 50 countries, I've previously referred to this, in the Lancet, that study confirmed that COVID mortality correlates more with obesity than with lockdowns. He quotes the head of WHO's Emerging Diseases Unit, Dr. Maria Van Kerkhove, advising against reimposing national lockdowns owing to health, social and economic downsides. An admission that lockdowns were wrong in the first place. As Professor Thakur says, panicked governments imposed hard lockdowns in a cascading rush, forcing people to live virtually in a state of terror, unquote. He made the point I've made many times. By definition, a pandemic is an international problem. And note this point, because remember, being told in threatening language that a crisis is upon us, and these political heroes are our so-called leaders, and they're saving us. Well, note the professor's comments, quote, to ensure compliance from increasingly sceptical and resentful people, the focus has shifted from very low mortality to rising infections in an allegedly devastating second wave. Now, remember how I keep questioning the breathless announcements that more have tested positive. When Australia-wide the death toll is 331, only 54 cases are serious, 46 in Victoria. Yes, there are 610 in hospital, but they're not classified serious, and 594 in Victoria, 16 in the rest of Australia. We hear talk about the Spanish flu. If coronavirus was scaled up, as the professor says, to today's global population, it would translate to 250 million dead from the Spanish flu. Professor says, quote, yet authorities didn't close down whole societies and economies in 1918. The state didn't enter homes to tell people how to live, who and how many to meet, when, where and what they could shop for, and which businesses could operate under what conditions. As the professor writes, the global death toll from COVID-19 is around 700,000, making it the 20th deadliest killer on annual statistics. 14 causes kill over 1 million annually. The top killer is coronary heart disease with 9.5 million deaths. Influenza and pneumonia kill 3 million. Yet screening and treatment for many deadlier illnesses have been deferred because of the obsession, he says, with COVID-19. As the professor writes, in Australia, the average daily death toll from all causes is 432. The total COVID fatalities in 6 months is 331. And for that, as he says, people's lives, livelihoods, education and freedoms have suffered massively. He writes, quote, Melbourne is effectively under martial law, masquerading as medical law. And he says, this is public policy insanity. Coronaphobia will kill more than coronavirus. And the professor makes the very valid point. In the United States, more people have died from suicide and drug overdoses than from COVID. And an official government report estimated 200,000 people could die from the impact of lockdowns in the United Kingdom, including an extra 35,000 cancer victims because of missed screenings. As the professor says, quote, treat people as adults, give them the scientific guidance on hygiene and social distancing, transfer the burden of risk back to individuals for assessing the danger to themselves and the appropriate preventive measures and practices, unquote. Well, it's increasingly clear that governments have applied and persisted with the wrong strategies. I've argued that from day one. Professor Ramesh Thakur joins us from Canberra. Professor, people viewing this program are shaking their heads. In all our argument, you've stated what is fairly obvious, put in place strong international border checks, have pre-positioned and pre-approved equipment and procedures for screening passenger traffic at air and seaports on short notice, isolate and quarantine the sick. And you make the point that for the first time in history, countries have chosen to put entire healthy populations under house arrest. How would you, in a sentence, describe this policy?
Well, as I said, public policy insanity. We didn't assess the balance of risks for the targeted groups. As you've made the point, and as Andrew Bolt said just before you came on, the most vulnerable were the elderly, particularly living in aged care homes. We were not focused enough. It was too diffuse.
Well, I mean, as you said, it was easy enough from day one to identify who were the most vulnerable, and this could have been dealt with, and the other people could have got on with their lives. What would be wrong with that strategy?
I think that was a very sensible and sane strategy. Incidentally, that's what most of the successful East Asian countries did. Taiwan ignored the WHO. Vietnam did something similar. Even Hong Kong followed such similar policies. They put in place procedures after the earlier SARS and avian flu outbreaks, and they went into action immediately and very decisively and have been very successful.
as you said, quarantine the sick and lock down care homes. I mean, if you were marking, Professor, if you were marking government all of this, what would you give them out of 10?
I'd probably be a little bit generous because this was a new virus and initially we didn't know what to do. But why they have persisted with demonstrably failed policies, that's more unforgivable, I think.
Just before you go, congratulations on what you've written, but how do we break down this alarmism, this hysteria and this fear?
Well, that's a very good question. I mean, there was a poll in England and Scotland which showed that people seem to believe that 9 to 10% of the population has been killed by the virus. They've succeeded in instilling widespread fear and paranoia, and we need to step back from that, start disseminating the facts. And the media, I think, has played a role in fanning hysteria.
Absolutely. Professor Ramesh Thakur, thank you for your time. Professor
You're welcome,
Thakur is a Senior Research Fellow from the Crawford School of Public Policy in Canberra.